Joining us now is Dr. Claudia Kim, and we are going to be talking about plastic surgery, both surgical and non-surgical treatments. Welcome to the show. How are you?
Thank you so much. I'm super excited to be here.
Before we were talking here together, we were also talking a little bit about your why you decided to become a plastic surgeon. Tell us about that, please.
So from my personal history, when I was 16, I had gotten into a pretty bad car accident with significant facial trauma. And so I was a patient. And so admittedly, for about a year, I didn't look at myself in the mirror just because of my lack of self-confidence. I was just not comfortable with the way that I looked because of my facial trauma. And so for that period of time, especially in a 16-year-old's life, when appearances mean everything and everything is just, it makes you feel so small, and it was a big traumatic experience for me. And so I built on that experience to actually help other people feel more confident in their appearance.
One of the things we were talking about too is the fact that cultural features that we're born with, it might be like certain ethnicity, right? With cosmetic surgery or non-invasive surgical, we can almost look like we want to look. We can kind of maybe choose some of the structural features, right?
So that being said, just because you can change it doesn't mean necessarily that you should change it. Because I really believe that all our what we perceive as imperfections are actually what makes us very unique as an ethnic group, as like a society. And especially since we are in New York, right? We are the cultural melting pot of the world. And we really need to appreciate everyone's unique differences. And so I think, it becomes a little bit dangerous, especially with like very young individuals who can be easily influenced, that we should celebrate differences, right? And that being said, we should enhance these specific characteristics that are unique to each ethnic group. Obviously with Asian cultures, with European cultures, with, African Americans. So I think that when we perceive aesthetic medicine or cosmetic changes, we should be enhancing. We should never really obliterate certain characteristics, because I think that makes it really special.
Okay, so you're more of a person that would like to enhance someone's natural beauty.
Absolutely.
Okay.
Absolutely.
So what are some of the techniques, because it changes so rapidly? What are some new procedures that you would like to bring to light today?
I love that you asked that question.
Okay.
Because as we see in fashion, as we see in beauty, that there are trends, right? And even in cosmetic surgery, we tend to see that there are certain trends that become popular, right? So historically, if we look at the 90s, right? The thin, very, wavy kind of look that kind of hit the market. And then you get into like the 2000s where like the curvy features became more prominent. And so currently there is a shift towards more conservative, more natural. And I think you can see it in a lot of the celebrities that are kind of getting away from, looking like you're done up, right? Because you want to be more natural.
Or like lips that hit the room before you do.
Exactly, right? So when we use aesthetic medicine or cosmetic surgery, just because it's something that can enhance you, people take it a little bit too far. Too much of a good thing is never a good thing, okay? And so we're starting to see a more conservative approaches where a lot of people are like removing the fillers, right? So the filler face or the pillow face, people are starting to kind of remove that and kind of go back to like their natural look.
Are you able to help them do that?
Oh, absolutely.
If someone has had a procedure somewhere else and it's not working, or it's drooping, or it's like, do you have to sometimes fix a face if you can? Okay.
Yes. And a lot of the times, because my patients know that I'm much more conservative, if there's something that I truly don't believe is a right fit for them, I have no qualms about saying no.
You'll be like,
and you know what? It's up to the patient to whether to pursue, to continue their treatments with me, or if I'm not giving them what they truly want, then they'll go find it somewhere else. But for my practice and my ideology, I think more natural and conservative is best for individuals.
Gentle and sustainable.
Exactly.
Okay. So you personally, you're beautiful.
Oh, thank you.
So whoever helped you along the way, I'm sorry that you went through that pain and that suffering, because that's very difficult. I remember also in high school, we had a friend that had broke their neck and they had to walk around with a halo, and people were cruel. They're like, oh, Frankenstein, because you have to have the halo with the bolts and things like that. That's a very tender age. Those teenage years. And as we grow older, sometimes those teenage emotional scars stick with us, right? Or whether we were made fun of because of the shape of our eyes or our nose or, our teeth are crooked or whatever it is, right? I think that also is the reason that sometimes people come to you for maybe a little different look, right? So sometimes as long as it's gentle and sustainable, right? You can help someone take their natural features and look their best. What's one of the success stories that you've seen throughout your journey so far, where someone it just helped them have like a different attitude or something?
So there's so many,
Okay.
right? I think everyone deserves the right to feel comfortable in their own skin. And whether it be, another trend that I'll mention is that with the massive weight loss patients, right? So with the popularity of the weight loss medications like the semaglutides, the GLP-1s, and so we are seeing a lot of people having significant changes to their body. And so they've put in all this work. So whether you're using medications to lose the weight or you've had some kind of bariatric surgery or with just, good old diet and exercise, a lot of patients put a lot of work into this. And a lot of the times it feels like their body is not reflective of all the work that they put in. And so
their skin is hanging.
Exactly.
Right? They have like,
and so now they're healthier and now they're happier, but it's not a full, complete picture. So when these people are coming in, it's like, I've worked so hard, but it's not what I envisioned. And so for me to be able to kind of bring their final picture into light, it's just a wonderful feeling. And even, let's say, not even weight loss patients, for women who've had children, right?
Yes.
Because kids take a toll on your body.
They do. Your rib cage expands. I'm like, you're just like, what's going on?
And you never go back to where you were before. And it's you've created a miracle, right? So how many people can say that I've created a human life inside of me? You've done a miraculous thing, but then your body is kind of not the same after that. So even little things of just, helping to feel someone comfortable in their skin, it's just so gratifying. And a lot of the times you'll see, in social media that people pursue plastic surgery or cosmetic surgery to kind of enhance certain features. That's not as common as people perceive it to be.
Fixing something like
Exactly. It's more of just like feeling more confident, and it's not altering something into like this very different picture. It's about just feeling more comfortable in what you feel and what you appear in.
Thank you. That makes perfect sense. You have a lovely personality, and I know that your patients are probably really grateful that they found you, right? Dr. Kim, what advice would you give to someone that's just starting on this journey? How do they know when it's time to make a call?
Okay. A lot of times I feel like the younger generation, they're so inundated with so much information with social media that they tend to do too much. And again, too much is not always good. And so when you're in that younger generation and you're kind of experimenting, obviously start slow. And a lot of the times preventative measures or preventative medicine tends to be much better than trying to fix something that has already happened.
Okay.
Right? And so when I'm seeing these young patients and they're asking for too much, a lot of it's just step back. You're beautiful for just being young, right? And then celebrate that. And you can do, like, let's say even something like sunscreen, right? Sunscreen is huge, and a lot of people don't realize that prevention, right? Prevention of the wrinkles, and start slow if you're doing, like, let's say medical grade lasers, or you may dabble in some injectables, but don't try to do too much. You have plenty of time to get into more of the invasive measures. But if you're starting off, start off slow. And if you are kind of more experienced in this journey, obviously make sure you find a provider that understands your needs and what you're seeking to achieve, and someone who's very honest with you and saying, this is not for you. This is something that, is probably not going to be attainable, but let's get somewhere where you and I will both be able to meet your needs.
Beautiful. Thank you, Dr. Kim. Thank you very much. I truly appreciate your time, your knowledge, your expertise, and just having this wonderful conversation with us. Thank you so much. I hope that you enjoyed this. We will be right back after this, but we've been visiting with Dr. Claudia Kim.